Thank you very much for joining this regional coordinators welcome and induction meeting. My name is Hideyuki Shiroshita. I'm one of the founding president of Avoidable Disease Network. So we are very much delighted to meet so many regional coordinators from all over the world today. The current cohort, which commenced in April this year, has 32 regional coordinators from 20 countries. So some of regional coordinators have kindly agreed to extend their term of duties. Thank you very much for your continued support to ADN. And some of the regional coordinators are new to ADN. So thank you very much for becoming a regional coordinator of ADN. So during today's meeting, I will briefly introduce Avoidable Disease Network. Then Nivedita will explain the roles and responsibility of our regional coordinators, in particular about celebrating the International Awareness Day for Avoidable Disease. Then we will have question and answer session. Can I use my slide? I think yes, I can. Right, okay. So okay. So let me introduce Avoidable Disease Network. So Avoidable Disease Network is founded by Nivedita and myself on 12th March 2019. So ADN was launched at the fourth summit of the Global Alliance for Disaster Risk Institute at Kyoto University in Japan. ADN is a network led by two universities, University of Leicester, where Nivedita works in the UK, and Kansai University, where I work in Japan. So ADN is a diverse, dynamic, inclusive, and innovative global membership network of experts, practitioners, and researchers interested in avoiding human disease from natural hazards, naturally triggered technological hazards, and human-made disasters in low and middle countries. We also work in high-income countries such as Japan and the UK. So far, we have more than 1,000 members from 94 countries. So ADN exists to help policymakers, researchers, practitioners, and at-risk and high-risk vulnerable population make better decisions to save lives and reduce injuries to achieve sustainable development. So let me introduce ADN's philosophy. So regarding the definition of avoidable disease are any type of premature disease. So avoidable disease include earthquake deaths, tsunami deaths, drowning deaths, snakebite deaths, and so forth. So there are just examples. So any premature disease are avoidable disease. And there are three main reasons why we focus on avoidable disease. Firstly, we think reducing avoidable disease is social justice. Secondly, zero casualty is a reasonable target than zero damage. And thirdly, avoidable disease directly contributes to UN Sendai framework's target A and B. Sendai target A is about substantially reducing global disaster mortality by 2030, and target B is about substantially reducing the number of affected people globally by 2030. These targets work in interface with four SDGs, i.e. number 3, good health and well-being, number 11, sustainable cities and communities, number 13, climate action, and number 17, partnership for the goals. Then let me talk the reason why we think network is important for reducing avoidable disease. So network can be defined as people who are people that considered as a group whose members exchange information with each other. We have multiple membership of different networks, and this multiple membership can bring new insight to us and to others. We can mutually learn from the overlapping of the networks. We believe that ADN is an arena that people can communicate and interact with others to get new insight to reduce avoidable disease. In this light, so ADN itself is a network. In addition, we also build several networks to reduce avoidable disease. So we ADN are network and we build networks. To implement ADN's philosophy, we propose two different types of networks. The first one is a knowledge exchange network, and this exchange network, in short KEN, is a network for those who want to find yet unknown issues related to avoidable disease. If we don't try to figure out unknown issues, this will lead us to unexpected events that usually claim huge number of avoidable disease. And another one is local level action network. We call it LAN, a local action network, LAN. So LAN is for those who want to find solution to known issues related to avoidable disease. So in order to substantially reduce the avoidable disease, both KEN, CAN, and LAN are needed. So these are interconnected. Currently, we are implemented several projects for reducing avoidable disease. And one of the important activities project is the global campaign called IAD4AD. So IAD4AD stands for International Awareness Day for Avoidable Disease. And celebrating IAD4AD is a key responsibility for all regional coordinators. So this is the digital tile of our global campaign, IAD4AD. So this is my last slide. On 13 March 2023, ADN's International Awareness Day for Avoidable Disease was launched in Izumi-Otsu, Japan, in collaboration with the city of Izumi-Otsu, Mayor Mr. Minamide Kenichi, photo on the top, and then head of the United Nations Office for Disaster Risk Reduction, UNDRR, actually former head of the UNDRR, so Ms. Mami Mizutori. The global campaign is celebrated annually. We invite you to celebrate this day and raise awareness of avoidable disease in your cities, towns, and villages in your country. So IAD4AD is a 10-year global campaign. From the 11th year, we will drop the word awareness and continue the campaign as the International Day for Avoidable Disease. So due to our members spread about 100 countries, we mark the campaign throughout March, not on the day 12th of March. So for more information about IAD4AD, I think Nivedita will cover later. So let me stop my talk now. So thank you very much. Okay, so over to you, Nivedita.
Thank you, Hideki. I'll try to share my slides now.
Before we are going to your talk, should we have a self-introduction or you finish your talk first?
Yeah, fast. No, one of the sections, one of the
Mhm.
segments of my talk is also introduction.
All right, right, okay.
Yeah.
Okay.
Okay. You can see the slides?
Yes, yeah, we can.
Okay. That's great. Okay. Thank you,
But
Hideki.
Nivedita, this is edit mode, not full screen. Is it okay?
Not full screen. Okay,
Mm.
okay, sorry. Okay. Can you see now?
Still it is edit mode. I think you
Edit
finished.
mode?
Yeah, you have to, end share screen first and then restart share screen.
Sorry, what do I have to do? Stop sharing?
Stop sharing first and then
Yeah.
and then restart the sharing.
Restart the sharing. Okay.
Yeah.
Mm-hmm.
And select the intended slide.
Can you see now?
Still edit mode.
Still edit mode? Okay.
Yeah.
Lisa, when you tried to reopen sharing, did you see a full screen version as a new tab?
Oh yeah. Should I do that slide?
So you open that version. Yep.
Right. Okay. Let me see now if I could do that, or I will have to share it with you guys. Is this working?
Oh, no, still, it's edit mode.
Edit mode.
It said double click to enter. Oh, that was on our end.
So in that case.
Yeah, you start, the how to say, presentation mode first, then, yes.
Sorry, guys. I'm not very good at this.
Click in
Right,
the
okay,
TV icon there.
sorry. Okay, I've stopped it. So now should I go in again?
Mm.
Right.
Yeah.
So this is regional coordinators. Sorry, everybody, regional coordinators. Right, so I have opened the slides now in my desktop.
Mhm. Then
Then
start, the presentation.
start presentation, share. Okay,
Yeah, then,
then
yeah, share your screen.
share my screen. Okay, and now
Yes.
what? Can you see?
It's edit mode, but yeah, we can, delete the screen. So yeah, if you don't mind, you can go with this screen, no
Okay.
problem. Yeah.
Okay, so thanks, Hideyuki, and once again, welcome everyone. Thanks for your time. I know you all are very busy traveling in and out the country, so I can understand that. So really appreciate your time. And we had to postpone our meeting, which we had organized it a couple of weeks ago, but we realized that it was Eid festival. And we have to keep that in mind from now on, isn't it, Hideyuki and Umar? Because we've got quite a few regional coordinators who celebrate Eid and
Yes.
the other holy festivals that you need to do that. So
Mm.
we will be mindful of that. So we had to change that. So sorry for that, if that caused any inconvenience to some of our regional coordinators. So we will be more mindful from now on. So my name is Nipatita Ray Bennett. Of course, I can't see myself. That's okay. And Hideyuki and I founded the Avoidable Deaths Network. But Avoidable Deaths Network is not just, led and managed by Hideyuki and myself. We had an absolutely amazing team on board. Some of us are here today. So Lauren, if you could give access to your camera and wave. We have Lauren, we have Kelly. So Kelly, if you could just wave. We have Shohid Bhai, we have Umar, wave, or Cornel, please wave. So we have got quite a few operation team members who have joined. So ADN, is quite a big family, and this operation team is spread out across the world. And you will be hearing from them every now and then. Somebody's texting you, somebody's emailing you. So there's a big team behind the scene, and they are basically the engine of ADN, and they drive it. And I want them to drive it because we want ADN to become sustainable over a period of time. I don't like it to be centralized. So the decision making is pretty decentralized. We are open to ideas, innovations, and that applies to the regional coordinators as well. Okay, so I'm a professor of risk management and also associate director at the Institute for Environmental Futures, and I'm based at the University of Leicester. We are in the process of launching a non-profit spin-out company of the University of Leicester's Avoidable Deaths Network, and that is going to be called Avoidable Deaths Lab, ADL. So you will be invited for the launching, and we can also discuss how some of you can also play an important part in Avoidable Deaths Lab. Okay. Next slide. So this is the outline of my presentation. So first is to getting to know each other. Yeah, so we will spend some time to introduce ourselves. So I would say, 2 sentences. What do you do? Where you are from? And if you are anything that you are passionate about, just let us know. The second segment of my presentation is the role of a regional coordinator. What is your role and how you could become a global citizen of change, which is the point 4. And the segment 3 is a little bit about the global campaign and how the regional coordinator plays a vital role in the leading of the global campaign, which is the International Awareness Day for Avoidable Deaths, or IAD for AD. So before we move on to the first segment, I see Moza has raised her hand. So Moza, if you would like to say
I'm
anything.
sorry, I think it's just with me, but I'm still on slide 1.
You're still on slide 1? Can you see
Yeah,
slide?
I think you're talking about slide 2, but I'm still on 1. I don't know if it's only me, but I just wanted to point that out.
Okay, so what I will do,
Nivedita, on
we
the
can,
page where you've got all of the little tiles on the left-hand side, if
so,
you use that one to navigate, we can move the slide.
so Lauren, I'll do one thing. I'll send,
Oh,
so we
well,
can
can you
start the present.
send your slide to me,
Yes.
Nivedita? Yes, yeah, I
I-
will share my screen. Yes, no problem.
I will send the PowerPoint slides to Hideyuki, and now we can start the introduction. So we can start with Moza. So Moza, over to you.
Okay, sure. I was shocked with that, but sure. Hi, my name is Moza Al Marhoubi. Omani, let's say I'm in Oman right now. I think you are very aware of the area right now with the Iran and Israel war. It's very obvious. And I work full-time as a meteorologist. I had my bachelor degree in meteorology from Johannes Gutenberg University in Germany. And then when I started working at this job, I had an education to be tsunami early warning system operator as well. So I'm integrated into that. I'm doing my risk crisis and disaster management master now at the University of Leicester. And yeah, it's my first term being a regional coordinator. Back in March, actually, I did an online campaign, basically just LinkedIn, but it got a lot of view and widely shared, especially the Arabic version of it. It was about the heat waves and how it is affecting us. At that time, I discovered as well that there are no records at all of how many people died of heat wave. Like we would hear the news about a kid dying or someone dying here or there about heat waves, but there are no official records that are published to the World Health Organization or anything of such sort. Sorry. Should I mention something else? No, all good. Then that's it. Thank you from me, and back to you, Navita.
Yeah, Dr. Arifatul, you can go now.
Thank you, madam. This is Dr. Arifatul Kibriya from Bangladesh. I'm teaching in a private university as an associate professor. The university name is American International University, Bangladesh. I teach there, my department is social science, and I teach there sociology, and I have been working researching on indigenous issues for a long time. And my interest area is climate change, disaster, land-based climate change issues, culture, as my background is sociology. And so far, that's it. That you are asking me that what do I do and where I'm from. And if there's anything else to know, you can ask me. Thank you.
Thank you very much, Dr. Arifatul. So we can go to Dr. Lin.
Hello, everybody, and I'm Li Zi, and I'm from Taiwan. Maybe you know the bamboo tea or the Taipei 101. Okay, 101. So we are in a small island, and I teach in prevention education. So I am very happy can join this network, and I actually in this night I have the studying in the online and with the community people to talk about ADN. So very happy to join this family. Thank you.
Thank you, Dr. Lin. So Shohid Bhai.
Hi everyone. My name is Shahidul Haq. I'm working with ADN as a activity coordinator based in Bangladesh. My background is public health, and now I'm working with a US-based NGO in Bangladesh, mainly in the refugee camps. And I engaged with ADN since since the beginning. Thank you very much and welcome all.
Thank you, Shohid Bhai. So Shohid Bhai is like the front face of ADN. So he manages the email of ADN. Okay, so I can't see the next screen, Hideyuki, so I don't know how to go. So can you invite I don't know how to go to the next screen. So maybe, okay, we can invite Dr. Carlos.
Mm.
So Dr. Carlos, please introduce yourself.
Yeah,
Thank you.
thank you, Dr. Raybene. Good evening, everyone. It's already 10:30 in the Philippines, so it's good evening for me and good morning for you. So I'm the regional coordinator from the Philippines. My background is that I'm an emergency physician with subspecialty in pre-hospital care and disaster medicine. And I'm currently an assistant professor in the College of Public Health, University of the Philippines, Manila. And I'm also the head of the Disaster Risk Reduction and Management for Health Program and Disaster Simulation Center of the said university. And since my focus is DRMH, which is Disaster Risk Reduction and Management in Health, my focus is health resilience, which is lessening illness, injury, disability, and death in disasters and disaster events and incidents. So which aligns with the ADN, I think, mission and vision. Thank you. Back to you, Dr. Nibenita.
Thank you, Dr. Carlos. Absolutely. We are so pleased to have you on board. Thank you very much. So we can now go to Umar.
All right, Nevinita, I've been struggling with my network, so I'm using the phone now. Well, I'm Abdullahi Umar from Nigeria. I work with the Federal Airports Authority of Nigeria here. I'm an international terminal manager, basically a risk professional as well, and currently the global campaign coordinator for ADN. Thank you.
Thank you, Umar. So we can go to Assad. So Assad, please introduce yourself briefly. Thank you.
Yeah, I'm Asad. I'm here, a PhD student at the University of Leicester in my year 3. I've been associated with ADN family for the last over 2 years or so as regional coordinator of Pakistan, and that's all about it.
Thank you, Assad. So we can go to Azu. Azu, can you hear me? We'll call back Azu later on. So, there you go. Azu,
Sorry,
you are
I've been
muted. Muted. Yeah, you can. I
yeah,
can
I've
hear
been
you.
struggling with my network. Hello everyone. Good afternoon from here. I'm Azokego Nnaji from Nigeria, the regional coordinator for Africa from Nigeria. I did my master's in risk crisis and disaster management some years back under Professor Nibedita. And currently I work with Nigerian Center for Disease Control and Prevention, as well as an NGO, a PIN Public Health Initiative. The NGO deals with data management in HIV programming. And what I do currently is that we have a virtual network of capacity building that spans across the West African region. So I'm the coordinator for that West African Regional Hub on ECHO, using the ECHO platform. And currently, towards the tail end of my PhD at the University of Maastricht, Netherlands, and I'm working on reduction of deaths, reducing mobility by preventing unwanted pregnancy among adolescents, especially those of them between 15 to 19 years. Of course, we know that 50% of the maternal mortality comes from sub-Saharan Africa, and Nigeria being the giant of Africa in terms of population, virtually almost 20% of that comes from Nigeria alone. And so working in that aspect, of course, that's part of what Avoidable Death Network is all about, reducing mortality and morbidity where necessary. And I must say that I was influenced by Nbedita. Though she's not a doctor, but I noticed she was always interested in reproductive health. So by the time I finished my MSc in disaster management, I was already thinking in that direction. So like I said, I'm about rounding up, and incidentally, the first manuscripts in my thesis have just been published a few weeks back. So when I post it on LinkedIn, I'm going to tag ADN, because that is part of what we do to reduce mortality. And in this case, we want to prevent unwanted pregnancy, where we get a lot of mortality and morbidity through abortion and so many other areas. Thank you.
Thank you, Azu. All the best for the last phase of your studies. So I invite Orkunil to keep it brief and introduce. Yes, over to you.
Okay. Hi, I'm Orkunil. I'm 15 and I'm based in India. I'm a part of the Junior Champion magazine. I'm the founding editor. The Junior Champion magazine works to spread the voices of children and youths through speaking about loss and damage through their perspective. And additionally, I'm also an operation member, and I'm very privileged to be part of ADN. Thank you. Hoping to be working with you all soon.
Thank you, Orkunil. The privilege is all ours, actually. Right. So I invite Fariha.
Hello, very good evening from Dhaka, Bangladesh. I am Fariha Hassin by training. I am a medical doctor, but I am working in public health after from my graduation till today, and I want to identify myself as a public health worker. Currently, I am working in a Bangladesh Medical University in Department of Public Health and Informatics as associate professor. I am also leading a center which is called Center for Gender and Women's Health, and I'm also the director of the Division of Reproductive and Child Health. So I'm very happy that ADN has selected me as a regional coordinator from Bangladesh part. And I became so amazed. Just I found a new friend from Nigeria. Why? Because we are working in a same issue. Professor Nivedita, you know that. So my PhD is on demography. So I am always interested to reduce the mortality. You know, this is one of the core concept of the demography. So I work in the reproductive health in Bangladesh, and my main focus is to reduce the maternal death, which can be very much preventable. So I think we have a lot of things to share. And just to share with my Nigerian friend and all my new friends that I'm also working to reduce the death among the adolescent mothers in my country. I think we can do a lot of things together. And it's a very special moment, I think, for all of us. I hope we can add some new additional dimension in ADN. Thank you so much for giving me the platform. Thank you.
Thank you, Fariha. Fantastic. Right. So I will invite Dr. Nikhil Paul.
Yeah, hi all. Good evening. I'm Dr. Nikhil Paul. I am an emergency physician and assistant professor in emergency medicine working here in Mangalore, Kasturba Medical College. I also head an organization, Outdoor Medics. So I have a subspecialization in disaster medicine. So my area of interest includes disaster medicine, which includes the disaster prevention. Apart from that, I also train in first aid and various life support courses. As far as ADN, I've been working with ADN for last couple of years, and have actively participated in the last global campaign, last couple of global campaign, and also have arranged few webinars. And my area of interest with ADN, I'm planning to do more on snake bite as well as drowning prevention. Yeah, that's it.
Thank you, Nikhil. So I would like to invite Dr. Pukar.
Hello, everyone. Good evening. I'm Dr. Pukar Gupta, a medical graduate from Nepal. I am also a founder and president of National Health Action Force Nepal, which works in 4 domains, mainly NCD and maternal and reproductive health, emergency and disaster preparedness, and mental health. So I am heading National Health Action Force Nepal. Thank you.
Very much, Dr. Pukar. Thank you. So I invite Rachel. Rachel, can you hear me? There you
Yes,
go.
please. Hello, everyone. I am Rachel Nantume. I am from Uganda. I'm a civil engineer, and currently I'm working for the Ministry of Works and Transport. I'm a a student. I'm Dr. Nivedita's former student. I did my Master's of Risk Crisis and Disaster Management from the University of Leicester. I've also done research on drowning deaths, preventing drowning deaths among fishing communities around Lake Victoria in Uganda. This is my first time to be a regional coordinator.
Thank you, Rachel. So now I would like to invite Tahira.
Yes, thank you, Dr. Navidita. My name is Tahira Khan, and I'm currently serving as District Emergency Officer in the Punjab and Service Department in Pakistan. And with a dual academic background in chemistry and business administration, I have spent around 18 years leading disaster response operations, community resilience programs, and emergency preparedness initiatives at both grassroots and district level. And my work closely aligns with several sustainable development goals like SDG 3, good health and well-being, SDG 11, sustainable cities and communities, and SDG 13, like climate action. And I focus on reducing vulnerabilities, strengthening local capacities, and I promote risk-informed development. And I aim to minimize avoidable deaths and build safer and more resilient communities. And I'm honored to join this global platform to share insights and contribute to collective solutions. Thank you, Dr. Nabigita.
Thank you, Tahira. Tahira was awarded the ADN Hero Award this year for her innovation, frugal innovation that saved lives from people falling unwell in her province. So she's absolutely amazing. And next, thank you, Tahira. So next is our Vishal. So Vishal from India.
गाड़ी पार्किंग है हेलो
Yes, we can hear
pardon me,
you.
I'm keeping my camera off because of as I'm traveling. Happy to meet all 31 new friends with common interest. My name is Vishal Pathak. I'm working with All India Disaster Mitigation Institute, and I am researcher and practitioner. My background is social science, and very excited to be here. Thank you, Nivedita ji, and thank you, Yuki-san. Thank you.
Thank you, Vishal. So next, Winnie.
Hi everyone. Nice to meet you all. I'm Winnie Fedekeze. I am a lecturer in public health. I'm an epidemiologist. I am also a researcher at Leicester University, where I met Nivedita. I am also the evidence synthesis coordinator for ADN. I've been with ADN for 3 years now, just 3 years. But this is my first time as a regional coordinator. My research interest is around marginalization, representation of communities, community interventions, community development, as well as evidence synthesis. So I run a lot of big evidence synthesis to synthesize information and get recommendation. I was part of the drowning project and the snake bite project. In addition, my new venture now is creative health and creative methods, using creative methodology to engage communities in research around public health. So yes, nice to meet you all. Looking forward to working with you over the next few years. Thank you.
Thank you, Winnie. And Winnie has been very, been very instrumental in helping us to make 2 publications. And many of our ADN op members published for the first time. So yeah, we are very grateful to Winnie's leadership and support in leading 2 review articles. Thank you, Winnie, for that. And last but not the least, Zain from Belize.
Hello, can you hear me?
Yes, we can hear you.
Hi everyone, I'm Zain Doheny. I'm the regional coordinator for Belize. And just for context, Belize is in Central America because a lot of people always ask me where Belize is. Yeah, we're pretty small, in terms of population, 450,000. So the job is a bit easier for us. But my interests are in disaster risk reduction primarily, but I have now started to work a lot in terms of looking at road safety initiatives to try to see how we could reduce some of these issues we have. For just for context, coming up in the next week, we will be supporting an initiative by a parent who wants to promote motorcycle awareness because her daughter, who is a graduate at Galen University, who I thought she died right after graduation on a motorcycle. So we're seeing how we could support that initiative. But for most part, we're bringing awareness, sensitizing public, and our hope is to continue pushing the ADN agenda in Belize so that people could become more aware. Thank you.
Thank you very much, Zain. I just realized, Kelly, you haven't been introduced, so please introduce yourself. Can you hear me, Kelly? No? I think Kelly is some. Right, so what we can do now, we will take one group photo, if that is okay. So Lauren, if you, or Orko, if you could take screenshots, please. So if you
Okay.
could give access to your camera for a few seconds and smile, that will be great. So Orko, Neil, and Lauren, just tell us when it is done, okay?
Yeah.
Okay. And just wait a couple more minutes. There's still people turning cameras on. Okay, right. So I'll turn mine on.
Yeah, don't forget yours.
Okay, 3, 2, 1. Oh, just one more camera turning on just now. Sorry. No.
I think
Okay,
Zai
3,
switched
2,
on.
1. All done.
Thank you. Okay. I'm conscious of the time, but don't worry, we will finish it in time, maybe 10-15 minutes a bit late. So Hideyuki, we can now go back to my slides. So that was segment 1,
Okay.
introduction. Yes,
Right.
Fidan?
Okay, your slide is.
Fidan, you raised your hand.
Hey, sorry, it's accidentally.
Right. We've just finished introduction, so the next
You
one
can
you
go to the
need.
next one. You can move this one as well. Yeah, just very quickly on this one, many of you touched on the different areas of research that we do. So at ADN, these are some of the research areas that we are currently pursuing, which is women and adolescents' deaths from post-abortion complications during disasters and crisis. And we have developed 2 kits, low-budget kits, reproductive health kits. They're called facility and mobile kits. And we are trying to come up with business models to bring it to the global market. We have disaster education to reduce avoidable disaster deaths. Hideyuki is leading it in Japan for more than 10 years. Then we also have some theoretical understanding and development on avoidable disaster deaths. And my book came out, which is called Avoiding Disaster Deaths. As a compliment, you will all receive the book. E-copy of the book. You will receive it maybe in a day or two's time within the minutes when Umar sends the minutes of this meeting. You will receive a copy for your personal use. We are currently continuing research and outreach largely and engagement activities on snakebite deaths. And we do research on drowning deaths. So we are largely focusing on methodologies, and Winnie had already touched upon that. So we're looking into verbal autopsies and how to improve the verbal autopsy tools to record circumstances surrounding drowning deaths. Publications will be coming out soon, but these are some of the research areas that we currently focus. But having said that, our regional coordinators cover a wide range of research ideas, well deaths, emergency deaths, and so on and so forth. So that's all okay. We can move to the next one. Okay, role and responsibilities of regional coordinator. So we currently have 30, sorry, it's a mistake, 30 in total. So basically 7 more than the previous cohort of 25. 2020 through 2025 was the previous cohort. 13 of the regional coordinators are from the previous cohort. We have about 90 new regional coordinators representing 20 countries, so which is fantastic. And majority of our regional coordinators are currently coming from universities. And so they have a strong research background. And if they don't, the other regional coordinators are also coming with the research background, maybe through their NGO, think tank, or leading third sector organizations. Your role is for 2 years. The duration is for 2 years, 2025 to 2027. So it started on 1st of March. We're a little bit behind in organizing this. So your role would finish on 31st of March, 2027. If you like ADN very much over these 2 years, you can always drop us a message. We will be, we do engagements and we do consultations who want to stay and who want to move on. So that process will take place in the month of 2027, in the year 2027, either by me, but mostly led by Umar. Okay. The responsibilities are pretty flexible because we know you all are really busy. So the roles that we have come up with, the responsibilities that we have come up with are flexible, and they take into consideration your capacities and expertise within your context and your region. Can move to the next one.
Sorry, Nibadita. One correction. I think duration started from April 1st and end the March 31st,
yes,
right? Yeah.
We will correct the slide.
Okay.
Thank you very much, Rick.
You.
We can move to the next one. Okay, 2 types of responsibilities for a regional coordinator. One is compulsory, the other is optional. So when we send you the letter of invitation to join as a regional coordinator, we had supplied that template, which has the information about regional coordinators' role and responsibilities for 2 years. So the compulsory one is that we expect you to celebrate the global campaign, and there are different formats of celebration. And most of you have celebrated in some form or the other. There are very few regional coordinators who have not done anything. For instance, Moza was not our regional coordinator, and yet she led an absolutely successful Arabic campaign throughout the Global Campaign Month on heatwave. I think Dr. Carlos already did something by holding a webinar on avoidable death. Dr. Lin did it as well without being a regional coordinator. So I would say most of you, except for few, maybe Fidan, but Fidan kept following ADN. I know she keeps liking ADN. So I think Fidan, what we do. But other than that, on my right-hand side, I'm looking into the list of our regional coordinators. Most of you have done something, in tangent, passingly, or directly celebrated the global campaign. But as a regional coordinator, we expect you to celebrate. It doesn't have to be massive, small, simple, but one step at a time. Yeah, consistently over a period of time. And we will be having 3 different meetings starting from December, January, February, preparation for the global campaign. So you will not be left alone. There will be lots of guidance on that. Second, we expect you to submit an annual report. And this annual report is currently happening through the submission of the post-global campaign event. Okay, so Umar has followed up with most of you to submit that report. So it's short, 500 words. It takes only a few words, and we just need few pictures as evidence. Annual general meeting, it is led by Hideyuki Kelly. It's usually in the 2nd week of December. We will invite you. It's more like a update, progress, and then getting ready for the global campaign. We also have another annual general meeting in the 2nd week of February. It's just before the global campaign month. So basically, we only expect you to attend 2 meetings that takes place annually, and that's it. So these are some of the activities we expect from our regional coordinator. Optional. Now, some of our regional coordinators are very proactive. For example, let's say Fariha. She's very proactive. She's just going to launch my book in Bangladesh. So, things like that depends on the regional coordinator's capacity and time and the enthusiasm and motivation. So it is always bottom up. It's led by you, never led by me or Hideyuki. We'll provide you all the support that you need. Like last year, We had the floods in Bangladesh. Fatima, who is our chapter lead. 1 minute, I'll just close the. Sorry, it's just my daughter. She finished her exam today, so she's got a friend. They're very excited. I think. Okay, so yes, some of our regional coordinators do way over and beyond all these compulsory activities. So they do networking and development. As I said, it's totally optional. You don't have to do it. All you have to do is the compulsory bits. But if you do the right-hand side, you're most welcome. We will be happy to provide you all the support. Accountable talks of avoidable deaths. You could have a radio session. I know one of our regional coordinators, not exactly the regional coordinator, but the operation team. She does community radios. She's constantly sending me the recording for feedback. So we support those kind of things. Promoting future leaders. So currently we have 2 future leaders. I'm so sorry. I think we missed the future leaders, Sadia and Fahim. So Sadia, if you want to really unmute us, just realized that I have not covered Sadia. So Sadia is our future leader in Bangladesh, Fahim as well. So 2 future leaders from Bangladesh. They're based at Dhaka University. We mentor them, but they also, through our mentoring process, they also support the Bangladesh chapter, which is led by Dr. Fatima Akhtar. So, Sadia, if you want to unmute, sweetie, and just introduce yourself. I'm so sorry, I must have just, not seen the list properly. Can you introduce yourself very briefly? Sadia, can you hear me?
Yeah, I can hear you. Hello,
Yeah, go on.
everyone. Hello, Professor Nivedita. You might have not missed me. I have joined late, so it's not your fault, it's mine.
Okay.
Hello, everyone. I'm Sadia Fin Saifanegaban, currently studying at the Department of Meteorology in University of Dhaka, a 4th-year student. Currently, I'll finish my university honors university within few months, I guess. I have been associated with ADN since more than a year now. I have learned a lot from everyone. They're so helping. They will help you get through any problem, whoever you reach. They're like the sweetest people, honestly. And I have been, as ma'am said, I have been as a future leader intern. I have supported Fatima ma'am last year to arrange all that flood donation, and we have reached around 200 kids to distribute those bag full with medicines, stationaries, and they were so happy. Those faces, which I'm never gonna forget, those smiles of the kids, and it's amazing to be associated with them. And to everyone, welcome to the team. That's all.
Thank you, Sadia. That's very kind and encouraging words. Okay. And the other one is that if some of our regional coordinators would bring 20 new members, yeah. So Assad brought Tahira. Assad brought few others. So some of our regional coordinators, as I said, go over and beyond their compulsory activities and bring new members. So you are most welcome to do that. If you want few future leaders to be part of our team, we will mentor them, but by doing so, they will be supporting you at a national and local level. I will come to you, Dr. Carlos, just 1 second, last point. And we also have a junior championship magazine, which is led by our Orkonil Ghosh and 2 other junior champions, Prarthana Datta, she's based in Canada, Anushka Khanar, based in Kolkata, and Orkonil, who is our founding editor based in Mumbai. They have done absolutely amazing job in releasing 3 magazines from 3 different countries. Now they're working with Dr. Lin Hideyuki to release the 4th volume on 13th of October with stories from Taiwan. Now the stories of Malawi and Bangladesh was actually supplied by our guest editor, Dr. Ranjan Datta, who is a regional coordinator. And for the Malawi, we sought help from Dr. Jean Query. She's based in the United States. So she kindly accepted our offer as a regional coordinator, but Jean is not able to join today. So again, Jean was not our regional coordinator. She became a regional coordinator, and she was the source to solicit all those amazing stories from the grassroots from Malawi. So regional coordinators can do these things. So you're most welcome to come up with new ideas, new stories, and we will always welcome that. So Dr. Carlos, you raised your hand.
Yes, I have two questions actually. One is related to the members. No? I have friends who were asking me before how to join as a member, and I don't know how to answer them. So, is it what you call the affiliates, and how will we make the members, and how will the ADN network recognize them as official members, if ever?
Thank you very much. So Arconil is designed to, Arconil just dropped the link to join ADN. So there are
Okay.
two ways, Dr. Carlos. So one is that they can join as an affiliate stroke member. And ADN doesn't charge anything, okay? So it's free of cost. It is done through the website and they will be receiving email from Shohid. So that's one thing. And for a regional coordinator, it's slightly different. The regional coordinator would be exactly like the way you would receive an invitation from me or Hideyuki, and then they are included into it. So if they're interested to join as a regional coordinator, we can have that conversation at a one-to-one and see if ADN is their right fit. Because ADN works are so niche that sometimes people, don't understand from the DRR world. They need to have a public health and epidemiology background a little bit to understand what's going on at ADN. So yeah, those are the two ways, regional coordinator or stroke affiliate member, and they don't need anything to pay. So I think Orconil has just dropped the joining link. So if you could just forward that, and then that's it. They can join.
For my second question, can I ask a second question now?
Yes, please. Yes,
Okay.
please.
So you mentioned research. Does ADN provide funding for research related to avoiding deaths?
Not yet. Not yet. But as I said, we are in the process of launching our nonprofit spin-out company. So that is basically a spin-out company of ADN. So that will generate income. And within that, from then, we should be able to invest in new research and new toolkits. So basically, the ADL is more around developing toolkits, kits, solutions that has commercial value and would generate income. And any surplus, any profit will be invested back into ADN's research. We are in that process at the moment. So we have funding for that from ESRC to launch this social entrepreneur or social enterprise, but it will be done by the end of this year. Okay, so the next slide, Hideki. Okay, those were compulsory and optional activities, but there are other activities regional coordinators do. These are evidence-based. As we said, ADN has been around for 5 years, and we have seen what the regional coordinators can do, what are their potentials. So these are some of the other activities that regional coordinators could do, and you could perhaps do the same. Number one, regional coordinators are eligible to launch a country chapter. So Pukar, you sent me some document, one document. So that is something around a chapter. So yes, regional coordinators are eligible to launch a country chapter. We have 3 country chapters, Bangladesh, India, and Oman. Now, I will tell you where these chapters are at this point in time. The Bangladesh is flying high. So that's one activity regional coordinators can do, launch a country chapter. Second, regional coordinators are also eligible to launch a case station. So Dr. Carlos, this is something, the case station, if we launch, then we jointly apply for grants. We jointly raise grants. So that is another way regional coordinators could do is launch a case station. Now we have Vishal Pathak from All India Institute of Disaster Mitigation Institute. They launched a case station this year. We have Bangladesh chapter, which is en route to launch a case station in Bangladesh. We also have another 2 case stations in the verge of being launching in Orissa and down south, which is by our Nikhil, Dr. Nikhil Paul. So, but the case station's commitments are for 10 years because impact cannot be seen within 2 years, and ADN's works are all around impact. So we think you need minimum 10 years of commitment. So for instance, Hideyuki's case station in Japan is running 11th year. My research in Bangladesh, which is on the reproductive health, is running on the 10th year. So it needs minimum 10 years of commitment to launch, to have the case station going. Second, regional coordinators can propose and lead webinars, side sessions at the UN OCHA's Humanitarian Networks Partnerships Week in Geneva using our platform. So we are a member of UN OCHA now. This year, we had about 4 or 5 UN OCHA sessions led by our regional coordinators. So you could do that. Asad led it, Dr. Ranjan Datta led it, and Arifatul was part of it. Fariha led it, so you could do that. So that's another way we can give visibility to your research and the impactful work that you are doing. So that here, it's not about we are benefiting from you, but also you benefit from our platform. So it's a win-win situation. Regional coordinators report about the case station through the annual newsletter. So usually Umar will write it in collaboration with you. So through the newsletter, we provide an update on our case stations. Some regional coordinators are research collaborators with Avoidable Deaths Network. So for instance, Fariha Hassin has been part of our research projects for now 5-6 years. So there will be some collaborators that we might contact and say, hey, guess what? We are bidding now, and we would like to collaborate with you. So at the moment, we are actually working on one project proposal and where the Bangladesh team will join in. So we can do that. We will invite you, but depending on the project proposal call. Some regional coordinators are collaborators for the Avoidable Deaths Lab. So Avoidable Deaths Lab, as I said, it's in work in progress to be launched by the end of this year, and some of the regional coordinators are already part of it. And now this new cohort is absolutely amazing, like Dr. Carlos is emergency medicine doctor. We also have Nikhil, we have Pukar. So it is possible that one day you might all get roped into ADL and it might generate some revenue for you as well through consultancy work. And might opportunities be for others as well. So it just, I'm thinking a little bit ahead and giving you some examples, the way you could get involved into ADN activities and how you can also benefit by being with us. And this is a new idea I'm floating around. We haven't finalized yet, but it depends on the appetite of the regional coordinators, because we actually have an absolutely amazing regional coordinators cohort with huge expertise, depth of knowledge from the entire spectrum of public health, DRR, epidemiology, community engagement, and so on and so forth. So maybe we could learn from each other by having a regional coordinator lectures. So I would need someone who would lead that. And maybe we could have 4 lectures each year, year 2, another 4 lectures, depending who is willing to speak. But this is more for us to learn from each other and do collaborations if there are any opportunities. But again, please drop us an email or drop me a message on WhatsApp and saying whether you guys like this idea of having regional coordinators lecture. Okay, we can move to the next one. Okay, so this is a little bit on the global campaign, which is our International Awareness Day for Avoidable Deaths. It's a 10-year strategy. It's a 10-year campaign. We already passed 2 years. We have 8 years now. So the idea is that we want to launch 50 to 100 country chapters. Yeah. We don't know whether we'll be able to achieve it, but it doesn't matter. The process is important. So we already celebrated the global campaign across 20 countries within 2 years. So we hope that it will catch traction, it will keep spreading, and we will have more global campaign across the continent. So that's one thing. So what does the activities involve? Bidding to host an in-person IAD for AD events. So the regional coordinator who launches the case station are eligible to bid. Okay, so in year 1, the India chapter host, Dilip Patnaik, made a bid saying that I will host the global campaign event in person in India. And he won it, and many of us went there. Now, Dr. Fatima is not here today, but Fariha Hassin is here. So the Bangladesh team has made a bid saying they want to host an in-person event in Bangladesh next year on 12th of March. But initially our plan was that we will only have 2 in-person global campaign events, year 1 and then in year 5 and then in year 10. But I think there is a demand. Bangladeshis are saying, let's meet more frequently and we are willing to host. And that host event is going to be led by Dhaka University in collaboration with Bangabandhu, not Bangabandhu, it's been renamed, Bangladesh Medical University. And I'm going to Bangladesh next week and I will have more detailed discussion and see how all the regional coordinators can travel to Bangladesh 2026 in the month of March. As I said, anyone who launches the case chapter and one has to be a regional coordinator, for them it is mandatory for them to celebrate the global campaign. Sometimes some of our regional coordinators don't celebrate the global campaign. We can't do anything about it, we really can't do. But for a chapter host, they have to celebrate the global campaign. It's compulsory. And they also become the point of contact. So if I go to Bangladesh, if there is any activities going to take place, I have to contact Dr. Fatima, who is the Bangladesh country chapter lead. And they also become a spokesperson for PR, media, press, etc., etc. So these are some of the roles that regional coordinators who host a country chapter does. Second, if you launch a case station, being a regional coordinator, your commitment is for 10 years, which would mean you have to think carefully that what if I leave my current job and move elsewhere? Then what happens to the case station? Yeah, so the case station belongs to an individual. The case station also belongs to an organization. So those are some gray areas that one needs to really think about when they're committing to launch a case station. So it is also a big individual's responsibility for 10 years to work on that. So activities for case station involves outreach activities twice a year in the month of March and month of October. These are aligned with the global, the International Day for Disaster Risk Reduction on 13th of October and our global campaign event in the month of March. So it's not, it's in a way, nicely it overlaps, it doesn't overburden. So these activities can be coordinated and coincided with these two global events. The case stations are directed for high-risk population. They're place-based approach. They're designed to promote change behaviors, health education, promotion. These are basically risk reduction behaviors so that injuries and avoidable deaths could be minimized in those kind of high-risk resource constraint context. Our focus is lower, middle, and low-income countries, but Hideyuki focuses on high-income countries in Japan. It is possible Taiwan might also have a case station, so we do also on high-income countries. So I've mentioned lower, middle, and low-income countries is because it carries the burden of disaster deaths, according to the UNDRR data. Our focus is also to raise the visibility and reduction of avoidable disaster deaths and injuries, and its high-risk and vulnerable population that carry the burden. We try to focus. We have these 2 networking models. Hideyuki has already mentioned about it. Knowledge Exchange Network, there's a typo here. It should be KEN, and Local Level Action Network. By doing so, these are the ways that you could become a global citizens of change. We can move to the next one. So target countries for our chapters and case station launch. India chapter, we launched it in 2020. Currently, we don't have a host. So if there is anyone from India willing to host the ADN India chapter, please drop us a message. Bangladesh chapter was launched in 18th of June 2023. Dr. Fatima is leading the case station, leading the chapter, and she's doing a brilliant job. Oman chapter was launched on 25th June 2023. We are looking for a new host. So this is an opportunity for you, Moza, if you're interested. This is what happens. Regional coordinators take on and they launch, and then maybe over 2 years down the line or 3 years down the line, for various reasons, they're not able to continue with the chapter. So it is okay to have new chapter host, and you can come up with new ideas, new leadership strategies, and so on and so forth. Over the period of time, we also think we would like to have a chapter in Japan, Belize, Nepal, Pakistan, Canada, Taiwan, Nigeria. But these are just a list. There might be possibility that someone else, maybe Dr. Carlos and Nivedita, I want to launch it tomorrow. So, these are just ideas, but it's not fixed. I've just provided just to illustrate my point. Next, Tiki. Thank you. So procedure to launch a country chapter and a case station, we have a common framework. So this common framework to launch a country chapter involves 10 steps. It's on the website. So it is not like that, okay, I decided I'm going to launch a country chapter. No, there is a procedure, there's a protocol that needs to be followed. And also people who launch country chapter also have to have a MOU with the University of Leicester and Kansai University. But the MOU you can take ages and ages, because the higher education institutions move at an elephant pace, but it doesn't mean you can't do the job. You can continue doing the job. But yes, launching a country chapter means you will have a collaboration agreement or already have a collaboration agreement based on our mutual understanding. Same with the case station as well. It involves 7 steps. So you have to follow that 7 steps to launch the case station. Again, case station also is a kind of a arrangement for collaboration. It's not something that you can do it all by yourself. It is a collaborative agreement between these 3 universities, and we work on the outreach plan and design together, and it's a kind of a collective ownership. Now, you can only have 1 country chapter. So Oman will have only 1 country chapter. Japan will have only 1 country chapter. But you can have hundreds of case stations. Okay, so we have 1 country chapter in Bangladesh led by Dr. Fatima. We have 5 regional coordinators in Bangladesh. All 5 could have 5 case stations. Yeah, so 5 stations are unlimited. Case stations are unlimited. It depends on your research focus, motivation, and your commitment for 10 years with the high-risk population that you are working. Okay. Next slide, Hideyuki. So we also have few engagement activities. So please drop in session on Thursdays. Orconil always drops the Zoom in link. It happens every week on Thursday, 2 o'clock to 3 o'clock. Sometimes I'm not available, but Orconil, Kelly, Lauren, Umar are always there. So for the next 2 weeks, I'm not going to be there. I'm traveling. It will be Umar or Kelly. They manage it. If you have any questions, just let them know. They will get the answers. If they don't have it at this point in time, then they will drop you an email. We also have mini lecture on launching case stations and country chapters every 3 months. It's again on Thursdays, 2 to 3 o'clock. Date of the mini lectures. These are some standard dates, but we always can customize them based on the regional coordinators' need. Next, Hideyuki. I think that's it. Thank you very much. We already have taken the photo and I've taken much of your time. And now I welcome Umar to give few other logistical points that he usually leads as a global campaign coordinator and also a main point of contact for all the regional coordinators. So thank you very much for listening. So over to you, Umar.
Yeah, thank you, Professor Nebidita, and welcome everyone. Sorry, I won't be able to on my camera and I can't share a slide, unfortunately. I have some technical difficulties. But however, the prof has pretty much spoken about some of the things I actually intended initially. But however, just a bit to add with respect to IAD for AD. So as the regional coordinators, we follow up with you on helping to implement the ADN strategy for the IAD for AD. And part of it, and most important with that, has to do with that of the global campaign. And as soon as it's December, we reach out to you and begin to engage and see what are the activities you are planning for the IAD for AD. And basically, that starts from December. And like she rightly mentioned earlier, there will be 3 engagement meetings towards the IAD for AD. And we're expecting anything from the December after the contact per se, where we'll be expecting the planned activity from regional coordinator, those that are interested in the campaign. So because we tally that and upload them to the website. So it's something everyone can track to say these are the activity for the IED for AD. And also very important within that space will also be the post-event report, as earlier mentioned. And importantly, also there will be 2 webinars for the IED for AD, which will be held in January and February, just to help us have an understanding of what the campaign is like and the necessary support from the ADN's end. Then the other important one is the drop-in session. And interestingly, for the campaign, which is going to the 4th year now, I think we had the 3rd year just this year, a bit of statistics shows that we were able to, in the 1st year, about 30 country activities that took place across about 13 countries. And in the 2nd year, which is the theme also for the 2nd and the 3rd were the same. That's just do one thing. Could be lecture, could be training, could be seminar, just one thing. And for the 2nd year, we had about 40 plus activities across about 20 countries. And the current year, 2025, we had about 43 activities around 12 countries. So, and with the new RC coming in to join, I hope we move up a notch and with a host of activity around the country. By and large, any other issue, things that needs clarification, like Professor Nabilita earlier mentioned, we always come in during the drop-in session, 2 to 3 GMT on Thursdays. And where answers cannot be provided immediately, we can just also drop you a mail. And be rest assured, we are here to also support, help you, and so that we can all achieve our collective goal of helping to reduce disaster deaths, as the case may be. I want to welcome you once more. You'll be hearing from us soonest, like we've already started, via email, as well as the WhatsApp group. Welcome once more, and thank you.
Thank you, Mar. Thank you very much. Now the floor is open. So we're happy to entertain any questions, thoughts, anything that you have for us. But I think just to echo Umar's, if you know any friends, professional collaborators, networkers from other countries who you think might be of interest to ADN and could become regional coordinator, please feel free to suggest and we can get in touch with them. But of course, we will copy you. You would act as our mediator, so we won't be doing it without you. It will be done in collaboration and in consultation with you. Yes, Moza, please go ahead.
Yeah, hello. I just wanted to go back to the Oman chapter subject. I just wanted to know more information because I know it was held by the Yas Hospital. So it should be, I think, hosted by an agency or an organization of sort, right? So if I could have more details, then I can look for a possible partner in that matter.
Yes. So let us have a meeting when I return from my Bangladesh and Japan trips. I'm returning on the 8th. So we could speak in the 2nd or 3rd week of July. Thursdays, as I said, we are always available on Thursdays, 2 o'clock GMT. And Orkunil will drop the Zoom link. So please join and we can have more one-to-one discussion on the Oman chapter. It's just, I think, what happened to Mr. Albedi, I think Mr. Albedi has got too much going on. I think he's just not able to commit to the chapter. So that's the only thing that has happened. Sometimes, as I said, people's priorities change, commitments increase. It's life. It's life. And usually the ADN activities are all on passion. So Mr. Albedi is passionate about afforestation in the Oman, in the desert. So he grows on cedar trees. So that's what his passion was. But he was doing it as a hobby off time. But I think it's just taken a toll on him and his health and commit and time, I think.
I understand. Then I will try to look for a few potential people for this matter, or maybe like a university-based or a research institute, or maybe even a government-based. But just for me to understand, like, what are the criteria? Because I know, like, volunteering and how volunteering work. I have been in 2 volunteer groups for the past 5 years, and you see people coming in and out in like a glitch. You have to keep that in mind. Like, if we have an organization behind it, will be better or it will hold for longer. So I'm gonna look for like official authorities or a government. I would say like a university would be better, but I will look into it before I reach back. But I just need more details. So I will join in on when you're back, and then we can discuss this more.
And this is a very valid point Moza has raised, that the regional coordinators' roles are voluntary. In fact, everybody who works at ADN, all our operation team members work voluntary. And there are challenges of voluntary work. Really big challenges, so you rightly said people come in and go out. So yeah, something like that happens at our end as well. But you are right. We found that working with higher education institutions or think tanks are better than just having maybe a hospital or an NGO. But having said that, I might be wrong as well, but more or less what we have seen is that it is better if higher education institutions where a researcher has been pursuing research on this particular topic, then it's a nice marriage. It's a good marriage made in heaven. So there's a coincidence, overlap of our research interest. But I don't know, Hideki, if there is anything else that you would like to add.
No, all good. Thank you. I can double my hand.
Any other questions? So yes, Moza, I will talk you through that 10-step framework, and there are some criteria to launch a country chapter, who can, who can't. So we have that protocol in place. We have Dr. Carlos, any more questions?
None for me. Thank you very much.
Okay, that's great. Vishal, do you want to say a few words? I know you were traveling on the case station. And then I would also invite Dr. Nikhil Paul to say a few words. I know he's thinking of launching a case station. I don't know where he is at the moment, but Vishal has launched it this year. And we will be having the first outreach activity in the month of October. So Vishal, can you give us a little bit of an update on the case station?
Thank you so much, Professor Nivedita. Hello. So we have this Ahmedabad case station on extreme heat avoidable deaths. This is really for us a good start. We are emphasizing on both sides. One is on research as well as also on the education aspect with the vulnerable population, especially with small informal businesses and their children and their location and their station where they are mostly using. So it is recently, started, but we are more formalizing this with and integrating with our AIDMI's activity on extreme heat prevention. Looking forward. Thank you, Professor Nivedita.
Thank you, Vishal, for that update. And we will have further update during our upcoming webinar. So we have a webinar coming up on loss and damage. So Orkunil, what's the date? I've forgotten. It's next month, isn't
10th,
it?
it's 10th July. Future Leaders one, right? 10th July.
Yeah. What time is that?
I think it's at 11 a.m. UK time.
Great. So Orkunil, if you don't mind, can you drop the registration link here? So, you're most welcome to join the webinar. And Dr. Carlos, if any of your students would like to join, please, and Vishal will be co-chairing anyway. Winnie, your students as well. Fariha, if any of your students. So, and of course, Moza and Fidani, everyone is welcome to, attend. And I want to invite Nikhil. So Nikhil, I know you have been you've been planning to launch a case station. So what's the update? If you could give us very briefly. I know we have 2 minutes, and then we'll wrap
Yeah,
it up.
hi. Yeah, hi, good evening. So the update is that so we have identified a village. So initially I had planned to launch in near a village near north of Karnataka, but then had to change that because of the accessibility and there were some follow-up issues and all. Now I have contacted another organization who's working along with the snake bite prevention as well as snake awareness, in fact. So they have suggested another village. So now I'll be traveling there in the next month. So I'm planning to go myself and meet a few people. And then I'll be able to give an update in another 2 months. So about the next plans.
Thank you very much, Nikhil. Hideyuki, you were talking with Dr. Lin, weren't you, about potential case station at the school level? No? Hideyuki, can you hear me? I mean, I thought that the Taiwan were planning to have a chapter and a case station at some point, isn't it?
Oh, yes, yes. Yeah, sorry. My internet connection was temporarily unstable. So now, what is the question?
The question was, I think there were some discussions that Taiwan would launch a country chapter and then case station down the line at a school level.
Yes, yeah. They are planning. Yes, yeah. You're correct. Yes.
So I think that's it, Hideyuki. Over to you. We have come to an end.
Yes.
So yeah, if you
Okay.
would like to conclude. And
Yeah.
from my side, thank you very much, everybody, for
Yes,
taking
yes.
part. Over to you, Hideyuki.
Okay. Yes, thank you very much, Nivedita. Yes, yeah, thank you very much, all for joining, this regional coordinator welcome induction meeting today. Yes, and actually ADN, all of ADN members are looking forward to working, with you for next 2 years. So thank you very much. Okay. Yeah. Okay.
Bye-bye.
Thanks to you, ADN team. Really very valuable. Thank you for all the spirit and bringing this positivity. Thank you so much. Looking forward. Ready
Thank you,
to and
Vishal.
available to contribute.
Thank you very much.
Thank you.
Thank you, Dr. Hideyuki. Thank you, Dr. Nivedita,
Thank you.
for having
Maria,
a very wonderful and nice session. Thank you.
Maria, we have to meet again. I'll send you the Teams
I know
link.
that. I'm ready for that. Okay. Thank you. Bye.
Bye.
Thank you, everyone. Bye.
Bye, Rachel. Hope everything goes well. Do take care of your health.